Hello, my name is Mike Logan, CEO of Michigan Masonic Home. At this time, neither Masonic Pathways nor Warwick Living Center have an open case of the coronavirus COVID-19 virus. However, Michigan Masonic Home is closely monitoring the coronavirus developments around the clock. As always, our overriding priority above all else is the safety and health of our residents, employees, and visitors. We take these health risks very seriously and have begun taking action to mitigate the potential of the COVID-19 virus entering and spreading within our community. Out of an abundance of caution, Masonic Pathways, Warwick Living Center have elevated the protocol in response to the COVID-19 virus. In addition to adhering to the guidelines for long-term care facilities and healthcare workers as determined by the Centers for Disease Control and the Michigan Department of Health and Human Services, Masonic Pathways and Warwick Living Center have a robust infection control protocol in place, which is monitored year-round to protect against seasonal viruses such as the respiratory flu and norovirus. However, the COVID-19 virus presents a significant risk to our residents and staff. As a result, we have elevated our infection control protocol to reduce the risk of COVID-19. What have we done? We immediately implemented our organizational-wide emergency response plan along with standard safety protocols. We have posted communication posters within the main entrance and throughout the community. We have implemented best practices for minimizing risk associated with the COVID-19 virus. We are following the recommendations of both Centers for Medicare and Medicaid Services and the Centers for Disease Control on prevention steps. We also are staying up to date with the Michigan Department of Health and Human Services recommendations as they continue to change daily. Lastly, we are in close contact with the local and state health department. What else are we doing? We've been having daily communication between departments and management. We have a multidisciplinary COVID-19 task force meeting twice a week to ensure resident and staff safety, as well as disseminate communications to key stakeholders, family members, employees, and residents. Here's a question that I received from a family member. Can I visit my loved one? At this time, we are restricting visitors from social visits with our residents. We request that family and friends do not visit Masonic Pathways or Warwick Living Center out of an abundance of caution. We are limiting all visitors to our community unless absolutely necessary. However, we need to ensure business continuity during this period. Those individuals who will have limited visitation include employees, contractors, and vendors who need to keep the operations running and assure the residents' needs are met, government officials who in their capacity require entry, immediate families and durable powers of attorney who need to visit for critical or time-sensitive reasons such as hospice-related visits, admissions, and medical authorizations. Thank you for providing me an opportunity to inform you about how Michigan Masonic Home is responding to the COVID-19 virus. We understand that our response to the COVID-19 virus may cause you inconvenience. However, it is our duty to ensure that our residents and staff have a safe and secure environment to live and work. Once again, we have no open cases of the coronavirus in Masonic Pathways or Warwick Living Center. I am grateful for your understanding and continued support of our mission. Together in service.